Casey with Wildlife ABQ is here, and we're going to talk about getting jacked.
Is that what we're going to talk about?
No, we're gonna talk. Females can listen to this. This will be good.
Yeah.
Then they can understand what testosterone is in men.
Have testosterone too.
Yeah, we're going to get into evolutionary psychology. No, we won't.
This is not what I signed up for.
No, I'm teasing. I'm reading a book on that called.
He's very excited to talk about testosterone.
Well, I've been reading The Moral Animal, which is so interesting to see how we respond evolutionary in the things that we do as humans. Like it's just so interesting. Like how everybody responded to COVID. You know, like being fear-based and all that. You know, those are natural responses to something that pulls us out of the norm.
Right.
So, but I want to get into TRT. And what does TRT mean?
Testosterone replacement therapy.
This is really important right now. I'm getting nailed on my Instagram like crazy. Like every few ads, because I'm in that age group, you know, I'm fixing to turn 48, old man.
You're the target market.
I'm the target market. Yeah. And it's just like, I can get it at home, testosterone replacement therapy. And you know, and so I want to get into, because you know this, like, you know, hormones, like you're an expert in hormones. So I think this is really, really important. And doing these at home things or getting testosterone from a buddy or, you know, going to certain clinics and they're jacking you up full of pellets. Like there's some really danger that can happen.
Yep.
You know, it's like if you like having 2-cup Reese's Pieces, probably not that bad, but that king size 4-cup,
yeah,
that'll do you in every time. Too much sugar.
Everything in life, including medical care, is risks and benefits.
So let's get into male hormones because I think this is really interesting. So what makes a male a male? Like, I mean, with his hormones, I mean, like. Well,
it starts when a man loves a woman.
That was the song.
So males and females, they both have the same hormones. We all have estrogen. We all have testosterone, progesterone. We have it all. There's a hormone pathway chart. I don't know if I have that on there. And it's the same. There is no gender hormone pathway, and that's for males and females. It's the same. The difference is the amounts. And so in one way that what makes a male is that they have higher levels of testosterone.
Right, like prenatal testosterone.
Yeah.
Yeah, when they're born. That's super high.
Yeah.
It infects your brain, and then it makes us like dumb apes.
It really is an infection.
Guys are listening to this, so we could be funny, but yeah, it does. It makes us aggressive. It makes us pick up heavy things.
Put things down, pick things up.
That's what we do best.
Yeah.
So we all have the same hormones, though?
We all have the same. Yes. I'm sorry, men, but yes, you have estrogen.
Well, I know that's a thing, and we'll get into that. So testosterone replacement therapy.
Yep.
Like we're getting these ads. People, you know, they have these Scottsdale clinics you can go to. They have all this fancy stuff. So here's a guy in his 40s. He's thinking, I'm tired. I'm fatigued. You know, I'm feeling like, you know, I mean, maybe I need testosterone.
Right.
You know, so we jump to that.
So the first thing to think about when you're looking at whether it's an online clinic or you're going to fly out to Scottsdale is what is that clinic offering? What is their business model? Because when you're offering hormone replacements and really that's your only product, every square peg, everything's a square. When you're a square peg, everybody's a square hole. And you're going to be hammering that to them kind of whether they need it or not. So you want to question.
Because you make money off of that.
What are they trying to sell me?
Oh, I see what you're saying.
And so you mentioned the whole at-home testosterone thing. And I was just looking into this today a little bit because I have some clients that they're just convinced that intramuscular, that the injection is the way to go. And I'm like, where is that coming
we'll tell
from?
people there's 2 ways.
Yeah.
So there's intramuscular, which you have to inject.
Ways, but
there's 3 ways. Or there's the pellets.
Would you like me to just go over it?
Yeah, go over it. Yeah, sorry.
So there's pellets.
Right.
And those get inserted every 3 to 4 months. Some clinics do real high doses and they do it every 6 months. There's the injection that is typically done every week. There's troches, which are these little like sublingual things.
Oh, I've never seen those.
There is oral. Nobody prescribes oral. And then there's the topical creams. And they all have different risks and benefits.
So so let's start with this whole idea of whether I'm deciding whether I need testosterone or not.
So first of all, our clinic is I don't really want to use the word holistic clinic, but we're a primary care clinic first and foremost. So we're looking at somebody from top to bottom, like how can we optimize your health And hormone replacement is a piece of that. So not everybody who darkens our doorway is going to get hormones. We're not going to hammer them over the head with hormones, because that's not really our business model. Our business model is memberships and a relationship. And if hormone replacement is part of that, then that's part of it. So what was the question?
No, let's use me for instance, because I don't mind. So I go in, you do all my blood work, because that's the first thing you're going to do with somebody. Yeah. Not just say, hey, we're a testosterone clinic, we're going to jack you up with testosterone. Yeah. That's how we get paid. Right. Your insurance is going to cover this, so you got to pay this, $200-$300 a month, whatever it is. Yeah. But you're looking at it as saying, let's look at everything.
Right. So you have these symptoms, like that's what you were saying.
Like I'm tired.
I can't lose weight. I'm sluggish. Right. All this stuff. It's like, okay, well, let's check a lot of things, including let's check your testosterone level.
So you guys checked everything. You found some things that was sufficient. My estrogen was kind of high.
Yeah.
But my testosterone was in the 600s.
Yes.
So I'm fine. I don't need
high-ish normal. Yeah.
Yeah, high-ish normal. So I don't need. If I'd have gone to one of those clinics, they may have jacked me up to super high levels, and we'll talk about that because that is dangerous too. Yeah. Because there's some guys that are out there that you have testosterone pellets in you that. Yeah. And your levels are through the roof. Yeah, so
water's great until you drown in it.
That's a great analogy. That's why you're the smart one here. So whenever you're looking at, whenever you're looking at that, so whenever I look at, what are you looking at specifically for testosterone? Because there's free testosterone and there's
pretty much just looking at the total and then matching that up with symptoms. And so right before the podcast, we talked a little bit about like, what if someone's 400? What if someone's 300?
Right.
The official diagnosis, I think at this point in the world, it's varied a little bit, but I think it's about 250 or lower is officially testosterone deficiency. But you're matching that up. I mean, it hasn't been usual. It hasn't been normal, but I've had a couple of patients that are 300 and they're like, men, and they're like, yeah, I feel fine. Well, then we're not going to change a thing because we're not going to break what's right. We're not going to fix what's not broken.
Right. If you're feeling great, yeah. I mean, or there may be other issues.
Yeah. And so somebody might come in sluggish. Their testosterone's fine. Okay. Well, what's your blood sugar? What's your iron level? Are you sleeping well? What's your vitamin D level? How's your mood? And
yeah. So there's a lot of different.
We are very complex beings.
Right. So it's not the one answer to have tons of energy.
When you only have one answer.
And be able to be super sexually active and, get jacked in the gym. The one answer is not just testosterone.
Not always.
Yeah. No. So, because I want people to understand that because I think it's really important because it's getting pushed. Because there's a way to make money off of this.
Yeah.
So, because testosterone is probably cheap.
It's fairly cheap. It requires a DEA license, so you have to.
So, because there's got to be, if they're pushing it this much, there has to be quite a bit of profit. It's got
a big profit margin, yeah, definitely. Providers get trained in different ways for these hormone replacements. So there's a lot of companies out there that are training providers. And so they're training them like, you got to make these people feel great. This is a business model. You got to like take them from like here all the way up to here. So they just keep coming back, coming back to get their crack. And,
yeah.
And so they feel good. And if they don't have it, then their own hormone levels drop. So they're no longer producing it themselves. So now they have to keep coming back. It's kind of not.
What is the,
and I wasn't trained that way. I was trained in a very conservative, non-brand name model. I was trained on the job with a doctor who was conservative, taught me all the pathways and all that stuff.
So when we're talking males only, because we'll do a podcast on females later, but when we're talking about males only, can you get into the weeds just a little bit so people understand estrogen and testosterone?
It's a big topic. So testosterone. Men that abuse testosterone, that go to super high levels, they get the boobs. Mm-hmm. That's a thing, right? And that occurs because of aromatization. I know every gym rat in the world knows what aromatization of testosterone is, and it's a pathway that testosterone can take to turn into estrogen. It's a pathway, but that pathway is typically kind of a bucket too full type of pathway. And so testosterone has two pathways. It's a 5-alpha, 5-bravo. And then if the bucket's too full, it'll aromatize into estrogen. The body's trying to get rid of it, trying to use it, get rid of it, whatever it doesn't need. It's aromatization. So that's how men can often end up with
boobs.
With boobs because they have estrogen, more estrogen than they should. And
so the testosterone can actually turn into estrogen? if there's
Yes.
too much of it.
Yeah. Oh yeah. Directly.
And then now,
there's no in between. It's
so now
testosterone to
you're defeating what the intent purpose was in the beginning.
And some people, they'll come in and they'll have these symptoms,
Right.
and their testosterone level's fine, but they have high estrogen.
Mm.
And so we address that. We block the aromatization because they just endogenously, your testosterone, I don't think we ever measured it again, but it might actually be higher now because we started doing some blocking of that aromatization pathway, pushing back on that, saying, no, don't turn this into estrogen. You
Yes.
keep it up here.
Right.
And that's how we address that. So we didn't need to replace testosterone to make. We don't always need to replace testosterone.
Yeah, this is really
Sometimes
important.
We have to adjust the balance and work with the metabolites and push back on different pathways. It's very complex. We should have pulled.
So you're saying that I'm in my 600s. I had high estrogen. We'll eventually test it again. So by knocking the estrogen down, and then also some other things. I worked on
the testosterone.
I worked on my diet. You talked to me about that. I worked on, and I've been working out more, which we'll get into that later.
Okay.
About workout and what that does to testosterone. But now you're saying I could potentially have even a higher number than 600s, and that's my body doing that.
Yeah.
Not getting jacked up with a bunch of pellets.
Yeah,
right.
we're nudging, and we haven't defeated your own body. We haven't stopped your own production.
Yes.
Of a hormone. Because once you kind of start on hormone replacement, you're kind of stuck with it. You can get off of it, but you feel awful. And because you're shutting down your own production, especially if you go super high doses, you're shutting it off.
So this would be something that you would really want to consider if you're doing it, because you're replacing.
In.
But if you're I've had friends in the military, and they've even been really young, and they've had 200s, because they're finding out that, concussions are causing, a lot of issues with PTSD and stuff like that.
I have a few young clients that are on replacement because of head injuries.
Yeah. So, if you're in the 200s and you're super sluggish and feeling crappy, then, you're automatically going to say, hey, let's make sure everything's good. And then let's look in that direction.
But those clients that we do replace that are young,
right,
they understand before going in that this is a lifelong decision, that they really are going to be on this for the rest of their life, this replacement. So nobody went in blind in our clinic.
Of course. Yeah. And
Not
I think
all clinics do that. They're just like, here you go.
You feel great. Yeah.
You'll feel amazing. You'll rocket to the moon.
But that's the thing too. It's being pushed that it's going to be like the super drug that's going to change your life and make you, an Instagram model, and then you're going to have, unlimited energy and all this. So it's not, what do you see typically when somebody begins to take testosterone replacement therapy? Normally, when they come back to you or whatever, how do they usually say they feel?
So if they're coming with us, they feel better. They don't feel like they can take on the world, or they can lift a car or something, but they feel good.
Right.
And libido's back, and erections are improved, and everything's better.
Right.
So they're still getting benefits, quite a bit of benefits. They're just not getting all the side effects that go with it of going too high.
So let's think about, because I think this is really, really important that people understand this. When they come to your clinic, they get the blood test, you're going to go over the test. Now, if they're a member of Well Life ABQ, what does that look like when they're sitting in a room? Yeah. They'll be sitting in a room with a doctor, nurse practitioner, whatever, provider, and then they're going to sit down, and then how are you guys going to go over it in 10, 15 minutes, or how does that work?
So first of all, our appointments are 30 to 45 minutes. So they're going to get an in-depth discussion about where they're at, where they could be, what are some of the things they could do without replacement, some nutrition, some HIIT exercises, lifting weights, sleep. Those are all really important for increasing your testosterone. So they're going to get the whole picture.
So this is going to be like a 45-minute meeting.
Yeah, and it's all included in your membership, that piece of it. And if you do topical, we're just sending a prescription to the pharmacy, then that's just part of your membership. There's no extra fees for that at all. If you're doing pellets, we do have a pellet insertion fee, but.
And usually, how long does that take? Do you have to wait a couple weeks to get the pellets put in, or?
No, usually we generally have appointments within a few days.
A
week at the most.
So if they come in, they have low testosterone, or you guys decide to take TRT, then you guys can usually schedule that a few days after that.
Oh yeah.
To do the pellets or whatever.
Yeah, we're not way out. People don't have to book way in advance just to get an appointment. So
because one of the things that I think men don't understand is having an active lifestyle, you know, especially when you're getting 40, 50, 60 years old. Like, you may be 60 years old. Why do I need to lift weights? You know, I don't want to injure myself, you know? Yeah. So, I mean, obviously you want to, you know, either have a personal trainer or do it properly, but why is it so important? Because I know you suggest that. Why is it so important to make sure, like, the sleep, the exercise, and the eating?
Because you want to optimize yourself,
right,
before you just throw something at it. At least in my opinion, you want to do that. So, and some people, they just kind of want, hey, I just want the quick fix. You're like, okay. I mean, it's your body,
right? And
I've given you all the information you need. I've shown you everything that you need to know, and this is what you're choosing to do. So that's fine. But we're not going to be like another clinic where we're just going to like just skyrocket your levels. We inherited a patient that just had just ridiculously high replacement levels from another clinic. And he was experiencing, he came to us, he had been to the emergency room because he had to have a bladder catheterization because his prostate had swollen so much, which is a side effect of testosterone, that he actually couldn't pee. And very painful. He got 2 urinary tract infections, which are really unusual in men, and that's because he can't empty his bladder because his prostate's so enlarged. He had been told to donate blood several times because his red blood cells were super high, and never once in that 6, 7, 8 months did somebody say, it's probably because you're doing testosterone and you're doing really high doses. Nobody ever told him that. Nobody ever paused to say, you're doing this to yourself. Do you realize that? And so he had I had met him in the community and chatted, and I was like, oh, we can do a lot for you, and you're doing this to yourself.
Right.
And so we have him like back down to normal levels. He's peeing. He's not having to donate blood. It was all from his super high levels of testosterone.
So what are the, because I want to scare some guys purposely. I say that. I know you don't want to, but I'm saying it for me. But what are some of the things that can happen if you jack up your testosterone that high eventually? What is going to happen to you?
Yeah, so it stimulates your bone marrow to make extra red blood cells. And we're in Albuquerque. I know not all your listeners are, but we live at altitude. So almost everyone who lives here already has high or high normal red blood cells. So we all already have kind of sludgy, thicker blood because of that. Mm-hmm. And then you add testosterone to that actually increases that. And then men, especially men who are overweight, they tend to have obstructive sleep apnea, snoring. And that actually raises your red blood cells even further. And so all that together can increase your stroke risk. And so that's one is testosterone replacement, especially too high, increases your cardiovascular risk of stroke or heart attack because of that red blood cells. Acne, cystic acne, that real deep, painful acne that's typically on the chin or the back, that's a side effect of too much. It could be a side effect of too much testosterone or not properly supporting the metabolism of testosterone. Because men who have normal levels of testosterone will have that, and we can help them with that. What else? I'm forgetting a major one. Oh, it enlarges your prostate.
Yeah, you said that with the other guy.
There hasn't been a whole lot of evidence with, it's not increasing risk of prostate cancer, but it can be a real pain because of that enlarged prostate. Gets in the way.
Yeah, I could imagine. And then, so they decide to make the decision. There's like, yes, this is something I want to do. My levels are lower. And so we can make an appointment, 2 or 3. What is the process coming into your clinic to get the procedure? Because a lot of guys may be scared of it. Like if they don't, do you suggest pellets or like what's best?
I really like if people will do topical first, just to get an idea of if they're going to like it. It doesn't give them a perfect picture of what a pellet's going to feel like, but it'll give them an idea of what it's like to.
So it's like a topical. Is it like a cream?
Yeah, it's just they apply it every day, every other day, something like that. But the pellet, if they want to do the pellets, and some of them want to do that right off the bat, and I don't blame them. Pellets are great. You come in every 3 to 4 months, and off you run, and you have this beautiful like biophysical profile testosterone. It just slowly rises, and then it just stays kind of nice. And if you get warm, you're working out, you get a little warmer, it dissolves a little more, so it goes a little higher, and then it drifts down, and so you don't have these peaks and valleys that are constantly.
Like if you were going to a clinic and getting shots.
If you're doing a shot, like they have to kind of overdose you with the shot.
Right.
Because it goes, even though it's like a long acting, it'll go up and then it'll kind of come back down pretty quickly.
So then that's
you have to
affecting.
do it every week, but so you're going through that every week. And so they found that the side effects of testosterone aren't really so much how long you're doing it. It's that peak level. It's the peak level that gets you. And so you're doing that over and over and over again with the injections.
So what is it like? So they get these pellets, and what are the pellets look like? It's like you're sticking pellets in my body.
Yeah.
Like that sounds scary.
Little, so there's only a couple pharmacies in the country that are set up to do pellets. They're sterile. They have to be sterile, obviously. And it's kind of funny because these BioTEs and these other Propel, they have all these different brands of pellets, but there's only so many pharmacies in the country that make pellets. So they're just making them in the same pharmacy. It's like when you get a brand name supplement that's being made at the same plant as the generic, it's all the same. And so there's only so many pharmacies. So it's made, it's sterile. We get it sterile, we store it. And then you come in, we numb you up real good, and we make a tiny little incision, and we have this special tool. It's called a trocar, and we make a little tunnel under your skin that's between your muscle, so it's like in your fat tissue. And then we just insert the pellets. Depending on your dose, we put so many pellets in, and then the incision's small enough where you don't actually have to have a stitch.
Oh, wow.
So it's just a little steri strip.
So these pellets are small then?
They're tiny, yeah.
I'm thinking like a pellet, like
Yeah.
like 3/4 inch pellet or something.
No.
These are very, very small. Yeah. And so then like some clinics you said do 6 months, but then that's going to mess up your levels. 3 to 4 months is the best.
Peak. So they're doing super high doses so that they can keep you from having to do pellets sooner. But that super high level is increasing your risks.
Oh,
and
yeah.
So, these brand names, they cost so much money. So these men are like, okay, I only want to have to pay this twice a year. And so the financial decisions kind of impacting the medical decisions as well. And so when it doesn't cost so much, if you're a member, it's only $150 to get a pellet inserted. And
every 3 months?
Every 3 to 4 months. And then
it's only $150 every 3 to 4 months?
Yeah, and you pay for the pellets.
Yeah, people are paying like some of these things online and everything.
$800 to $900.
Yes, yeah.
And so it's $150 plus the pellet. So men usually are like high 200s. They have to pay for the pellet, the cost of the pellets. We don't mark those up, but and women get out of the clinic usually right around 200. So
that's only every 3 or 4 months. Yeah. Compared to every month paying that.
Right.
Yeah. Because the shots and stuff like that are probably.
Yeah. And so clinics, web-based clinics, internet-based clinics, they really push the shot because just logistically they can't push the pellets. So they're going to be like, hey, the shot's the way to go. You can do it at home. Right. And from a business model, they have the reach. They can go everywhere. Anywhere they can mail it, they can have that as a person as a client. So as a business model, that's why they're like, oh, the shot's the way to go.
Right.
Because of it's an income decision.
Yeah, that's interesting to me how the model's so changing with everything. We're becoming so acceptable with Zoom and all that stuff.
Yeah.
That medicine is becoming online like that.
And I'm totally all about remote care and online when it's medically appropriate. But testosterone, IM is not actually something I even offer because there's a better way.
Yes.
There's pellets, there's topical. Those are pretty much all I offer is topical and pellets because those are the best ways.
So instead of starting off like you were saying, some clinics will just jack people right up to high levels. You like to start off low and then test and kind of see to get your body, because you don't want to like jolt your body into something. It's
an art. So it depends on how low you are, how much dose, what are your goals? What are you looking for? What are you comfortable with? Do you snore? What's your red blood cells right now? So what risks are you walking in the door with? And so that that's part of our decision making. So some people get what would be considered a fairly high dose just right off the bat because they were really low, they're having lots of symptoms, and we want to get them feeling good. Right. And then we'll back off. But we have some people that are like, because the people that match us come find us.
Yes.
And so we have people that are pretty conservative. They're like, no, I'd really rather creep up than go up here and creep back down.
What do you suggest?
What do you mean?
Like, is both ways fine, or would you suggest creeping up?
Either way's fine.
Oh, okay.
Yeah, because you're only going to do that kind of shoot the moon one time, and then you're going to nudge it down. So.
And then it'll be, but
they don't have any risk factors walking in the door.
So they get the pellets, 3-4 months, they come in, they get more pellets again. What do you suggest, like once a year testing it, or how often do you suggest testing the testosterone levels?
At first we test it every time. A post 6-week pellet check, the peak, we're looking to see how high we got you. And so we're checking at definitely the first 2 rounds. Usually the 3rd round we'll do it. If we make no dose adjustments in those 3 rounds, then you're good. We'll test.
So you're checking because I want to make sure us apes understand this, guys. We got to keep it simple for
Yeah.
them. So you're checking to see what level they peaked at.
They peaked at, yeah.
And then from there, you can adjust the pellets the next time around to have that balance.
To get a nice risk benefit balance.
Now, are you checking estrogen too, along with that? So you're
yeah.
checking testosterone and estrogen to make sure those two.
Yeah, because
What have you seen that has been, this is interesting to me. So what have you seen when that first go around of pellets? What have you seen usually happen? Is it usually pretty smooth sailing, or do you have to adjust again? Like, does the estrogen go way up too, or?
Usually on the first round, the testosterone level shoots up real nice. Estrogen usually behaves itself. The estrogen will kind of, it'll be the second or third round that we'll see estrogen become.
So it takes that long.
Yeah.
And then from there you have to deal with the estrogen level.
Yeah,
if it goes too high.
We'll lower your dose. We'll push back on that pathway with some supplements. Or we can improve the metabolism of estrogen. So we're either plugging the leak at the roof, or we're opening the drain at the bottom to get rid of the estrogen.
Oh, okay. That makes sense. Yeah. So, and you said supplements can do this?
Yeah.
That's interesting.
They're all herbal, yeah.
Yeah. So, I mean, these are not even, but you have, so I kind of want to get into that a little bit, because I was taking like different supplements and stuff like that. And then just on the fish oil side of things, which most everybody should probably take fish oil, right?
Yeah.
But you showed me, and it was really interesting. I had Costco fish oil and then your brand of fish oil. And you were literally like, you're going to have to take like 8 of these. So if I want TRT replacement and I'm a candidate for it, I've gone through the tests with you. I've signed up. I pay the $75 a month, but that's not just for the TRT. That's for the, because I want people to understand this.
All of your primary care, yeah. To me, it's a no-brainer. You get your entire primary care, you get your testosterone replacement, anything else you might need under one roof. You're not going everywhere and people are disagreeing with each other and you're getting this supplement and that prescription. It's all in our house.
Yeah, because I'm a business owner. I'm 50 years old. I'm trying to get all this. I don't need, because the clinics will do that, right? They will send you to this place, this place, this place, and next thing you know, you got 4 appointments.
Yeah, and you don't have time for that. And so the membership's the way to go. It's just one-stop shopping.
Yeah, and then you can come in, you can get the TRT replacement. They're going to check your blood pressure.
Get your blood drawn
vitamin
there.
D, all that. So you'll draw the blood there too? Mm-hmm. I don't have to go to a lab to get it done?
No, if you don't want to.
Oh, wow. That's cool. And then the pellets are done there.
Yep.
So, literally everything's done there.
We don't like having to send people out into the jungle, is what we call it. So yeah, we really, really try to make sure we have all the services that are within our scope of practice to keep it under that roof.
So if you're an individual, you can go online. There's an enroll online button on the website, welllifeabq.com. Yeah. If you're a business,
and you're looking to sign up your business, it can be a little more complicated. It kind of depends on where you're at. What does your health benefits package look like right now? Where does our puzzle piece fit in with your puzzle piece? And so it's good to have a little meeting so we can get you started right. So we can talk to your employees that you're going to be signing up so that everybody understands what they're getting. It's $75 a month, but if you're not using it, then you're not going to benefit from it. So
yeah, exactly. And they can go on there and then they can fill out. It's under business. Because you have individual and business, two separate tabs.
We have a business tab, or you can just email me directly.
It's employers. Yeah. What's your email?
KC, like the Sunshine Band. So just the initials, KC at welllifeabq.com.
So that's KC welllifeabq.com. And the contact information, too, is on the website at welllifeabq.com. If you're a male and you're looking at testosterone or TRT in Albuquerque, this is the clinic to go to. It's a balanced clinic, and we'll make sure that you have your complete everything, all your health.
Yes.
Is primary care wise is taken care of. Cool. Well, thanks, Casey.
Thanks.